Hi everyone, this is Nurse Anna from nursestudy.net. Today we're going to talk about croup, a very common respiratory condition seen in infants and young children. By the end of this lesson, you'll clearly understand what croup is, what happens inside the airway, why the classic barking cough occurs, the signs, symptoms, and diagnostics, nursing care plans with interventions and rationales, nursing priorities, complications, and patient teaching. And finally, 5 NCLEX style practice questions with rationales. Let's get started by understanding the pathophysiology in a way that actually makes sense. I put together a free NCLEX survival study guide to help you stay organized and confident. Feel free to download it with the link below. And if you want more resources, we have study guides and free nursing audiobooks in our store. You'll find all of those links in the description. Pathophysiology. Croup is most often caused by a viral infection, commonly parainfluenza. It affects the upper airway, specifically the larynx, voice box, trachea, windpipe, bronchi. Think of the airway like a narrow straw. In young children, that straw is already small. When a virus infects the lining of the upper airway, the tissues become swollen and inflamed. Even a little swelling makes a big impact because children have much smaller airways than adults. Here's what happens. The virus irritates the airway. The vocal cords and upper trachea become inflamed and swollen. Air has to squeeze through a tight, swollen tube. That creates the barking cough and stridor, which is a high-pitched sound made when a child breathes in. A good way to visualize this: imagine air moving through a paper towel tube. That's normal. Now imagine trying to blow through a tiny pinched tube. It makes noise and takes more effort. That's croup. Another key point: crying makes symptoms worse because it increases swelling and airflow turbulence. Croup generally affects ages 6 months to 3 years because their airway is smallest relative to swelling. The illness usually follows this pattern, starts with mild cold symptoms, then progresses to hoarseness, barking cough, and stridor. Worst at night, typically improves in 3 to 5 days, and that's the core pathophysiology. Signs, symptoms, and labs. Common signs and symptoms: barking, seal-like cough due to swollen vocal cords, inspiratory stridor, narrowed airway during inhalation, hoarse voice, vocal cord swelling, low-grade fever because most cases are viral, retractions, suprasternal or intercostal, child works harder to breathe. Worse at night, airway relaxes and swelling increases. Red flags. These require immediate attention: stridor at rest, drooling, difficulty swallowing, severe respiratory distress, cyanosis, lethargy. Diagnostics. Croup is mainly a clinical diagnosis, but tests may include a neck X-ray, steeple sign, shows narrowing of the upper trachea. Pulse oximetry may show mild desaturation if airway narrowing is severe. Since it's viral, no lab test confirms croup directly. CBC may show a mild viral pattern, lymphocyte elevation, but it's not routinely needed. Nursing care plan. Nursing care plan number 1. Nursing diagnosis: ineffective airway clearance related to upper airway inflammation and edema as evidenced by inspiratory stridor, barking cough, and suprasternal retractions. Interventions and rationales: keep the child calm and minimize crying. Rationale: crying increases airway swelling and worsens stridor. Administer humidified cool air or cool mist. Rationale: cool air reduces swelling in the upper airway and loosens secretions. Administer prescribed nebulized epinephrine if ordered. Rationale: epinephrine causes vasoconstriction, which reduces airway swelling quickly. Monitor respiratory status frequently. Work of breathing, color, breath sounds. Rationale: croup symptoms can progress rapidly, so early detection of distress is essential. Expected outcome: the child will maintain a clear airway with reduced stridor and improved breathing effort. Nursing care plan number 2. Nursing diagnosis: impaired gas exchange related to airway obstruction from inflammation as evidenced by low oxygen saturation and increased work of breathing. Interventions and rationales: apply supplemental oxygen if ordered. Rationale: helps maintain adequate oxygen saturation when airflow is limited. Assess for signs of hypoxia such as restlessness, tachycardia, or cyanosis. Rationale: these are early indicators of inadequate oxygenation. Administer corticosteroids, e.g. dexamethasone. Rationale: steroids reduce inflammation in the upper airway and improve airflow. Place the child in a position of comfort, upright position. Rationale: sitting upright reduces pressure on the airway and improves breathing. Expected outcome: the child will maintain oxygen saturation above 94% and show improved respiratory status. Nursing care plan number 3. Nursing diagnosis: anxiety, child or parent, related to difficulty breathing and unfamiliar symptoms as evidenced by fear, crying, or agitation. Interventions and rationales: provide calm reassurance and explain what is happening in simple terms. Rationale: reduces fear and keeps the child relaxed, which prevents worsening symptoms. Allow the caregiver to stay with the child at all times. Rationale: parental presence helps calm the child and decreases respiratory effort. Use a quiet, low stimulation environment. Rationale: prevents agitation and reduces respiratory demand. Demonstrate treatments such as mist therapy so the child knows what to expect. Rationale: familiarity reduces anxiety and promotes cooperation. Expected outcome: child and parent will demonstrate reduced anxiety and improved cooperation with care. Complications and nursing priorities. Possible complications: severe airway obstruction, respiratory failure, hypoxia, dehydration from poor intake, rare bacterial superinfection, bacterial tracheitis. Nursing priorities. Use A, B, C's. Airway: ensure airway patency. Calm the child. Use humidified mist. Assess for stridor at rest. Breathing: monitor oxygen saturation, respiratory effort, retractions, and stridor. Circulation: monitor color, perfusion, and heart rate. Priority actions include: keep child calm, administer steroids, monitor closely for deterioration, notify provider if stridor occurs at rest or if oxygen saturation drops. Patient teaching points. Teach caregivers. Humidified cool air may help at home. Keep the child calm. Crying worsens symptoms. Encourage fluids to prevent dehydration. Avoid cough syrups and sedatives. Seek emergency care if stridor occurs at rest. Child has difficulty breathing. Drooling or trouble swallowing occurs. Cyanosis or lethargy develops. Hand hygiene to prevent viral spread. NCLEX style practice questions. Question 1. A toddler with croup suddenly becomes very agitated and has stridor at rest. What is the nurse's priority action? A. Offer warm fluids. B. Keep the child calm and minimize agitation. C. Administer oral cough syrup. D. Lay the child flat to rest. Correct answer: B. Rationale: keeping the child calm prevents further airway swelling and reduces stridor. This is the immediate priority. A is wrong. Warm fluids may worsen swelling and increase coughing. C is wrong. Cough syrups are not recommended for croup and can be dangerous. D is wrong. Lying flat can worsen airway obstruction. Question 2. Which medication do you anticipate for a child with moderate croup? A. Albuterol nebulizer. B. Dexamethasone. C. Ibuprofen only. D. Azithromycin. Correct answer. B. Rationale. Dexamethasone reduces airway inflammation and is first line for croup. A is wrong. Albuterol treats lower airway issues, not upper airway swelling. C is wrong. Ibuprofen helps fever but not swelling of the airway. D is wrong. Croup is viral. Antibiotics are not indicated. Question 3. A child with croup demonstrates suprasternal retractions and a barking cough. What is the most important assessment? A. Bowel sounds. B. Skin turgor. C. Oxygen saturation. D. Capillary refill. Correct answer. C. Rationale. Oxygen saturation reveals how well the child is oxygenating despite airway narrowing. A is wrong. Not related to respiratory distress. B is wrong. Hydration is important but not the priority. D is wrong. Perfusion is less urgent than oxygenation in croup. Question 4. Parents ask why their child's symptoms worsen at night. What is the best explanation? A. Children drink less water at night. B. Airway muscles relax more at night. C. Fever increases at night. D. Viral activity increases at night. Correct answer. B. Rationale. Relaxed airways allow tissue to collapse slightly, increasing symptoms. A is wrong. Hydration doesn't significantly influence nighttime worsening. C is wrong. Fever may vary but isn't the primary cause. D is wrong. Viral activity does not change by time of day. Question 5. Which finding requires immediate emergency intervention? A. Barking cough. B. Low-grade fever. C. Drooling and difficulty swallowing. D. Hoarse voice. Correct answer. C. Rationale. Drooling and dysphagia indicate possible severe obstruction or epiglottitis. This is an emergency. A is wrong. Common in croup. B is wrong. Expected with viral illness. D is wrong. Hoarseness is typical and not an emergency. Summary. Let's review the key points. Croup is caused by viral inflammation of the upper airway. Swelling of the vocal cords creates the barking cough and stridor. Keeping the child calm and using cool humidified air are essential. Corticosteroids and nebulized epinephrine help decrease airway swelling. This is Nurse Anna from nursestudy.net. I hope this helped you understand the pathophysiology and nursing care for croup. Visit nursestudy.net for study guides, care plans, and NCLEX practice questions. Keep studying smart, and I'll see you in the next lesson.